Good afternoon, everyone, and welcome to today's briefing on COVID-19 in New Brunswick. Bon après-midi, tout le monde.
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick.
On behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honourable Dominic Carty, Minister of Education and Early Childhood Development.
Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honourable Dominic Carty, Minister for Education and Early Childhood Development. Dr. Russell.
Bon après-midi à toutes et à tous. Good afternoon, everyone. We have all been through a very long and difficult winter, and our province has been hit with successive waves of COVID-19 infections and the emergence of new, more contagious strains of the virus. Firm restrictions have been needed to limit the spread of COVID-19, and the pandemic is really still far from over, and we're likely to see more infections and further outbreaks in the months ahead. But really, with the advances that we're making in our vaccine rollout, they should be smaller outbreaks and they should have fewer negative outcomes if all goes well. And again, we can look to places like the UK and Israel and their data after their populations were vaccinated with 2 doses, so we expect to see the same trends here. Today, spring seems to finally have arrived in New Brunswick. It is a beautiful day filled with a lot of light and bright yellow sun. And now the light will shine in every corner of our province because pour la première fois,
for the first time since mid-March, all of New Brunswick will be at the yellow alert level in our provincial recovery plan. And I am so proud. Public Health has recommended to Cabinet that the Edmundston and Grand Falls areas transition from the orange alert level to the yellow alert level, joining the remainder of the province. This change will take effect at midnight tonight. I would like to offer my gratitude to the people of the Madawaska region who have been under various levels of restrictions for most of the last 5 months. For all but a 2-week period in March, all or part of Zone 4 has been at the orange or red alert level since late December.
So twice, Zone 4 has endured full lockdowns as the second and third waves of the pandemic hit our province. And your patience and perseverance have enabled us to slow the spread of the virus and bring this outbreak under control. And I'm so very proud of all the hard work that people are doing and have done to manage that. Over the last week, the number of active cases and hospitalizations in Edmundston and Grand Falls has declined, and there have been no new cases of community transmission. Very good news. While the risk of further infection still exists, conditions have improved to the point where Public Health can recommend loosening restrictions in Zone 4, and there is even more good news to share.
New Brunswickers over the age of 40 are now eligible to receive their first dose of the COVID-19 vaccine. You may book an appointment at your local pharmacy or through a vaccination clinic provided by the Horizon and Vitalité Health Networks. Anyone over the age of 12 with 2 or more chronic health conditions is also now eligible to be vaccinated. Minister Carty will have more to say about the progress of our vaccination program in a few minutes.
New Brunswickers over the age of 40 are now eligible to receive their first dose of the COVID-19 vaccine. You may book an appointment at your local pharmacy or through a vaccination clinic provided by Horizon and Vitalité Health Networks. Getting more vaccines into more arms across New Brunswick is a big step in moving us towards a more normal life for all of us. But everyone must remain vigilant and follow public health guidance. The vaccinated people just as much as the unvaccinated. And just anecdotally, I have seen cases, and we've seen cases in different situations where people have been vaccinated and still contracted COVID-19. And until our entire population is protected, we have to remain vigilant. Getting your first dose of the vaccine does not enable you to throw aside your mask and go out and party with your friends. And you may have been reading things on the CDC website in the US, but we are in Canada and we are in New Brunswick, and our situation is very different. So making sure that people are all protected with their second dose is our goal. And even people who have been vaccinated, again, that vaccinated, the immunity that you get doesn't really kick in until at least 2 to 3 weeks after that first dose, and again after the second dose. So it's really, really important that we all stay very cautious until we have that level of immunity in our population. So it does take 2 to 3 weeks for the vaccine to take effect, and the maximum benefit will only come 2 to 3 weeks after receiving your second dose. And in the meantime, again, we have to manage those risks of transmission and serious and negative outcomes. So likely by September, most New Brunswickers will be fully vaccinated, and that again is good news. But until then, it is very important that everyone continue to wear masks in public, observe physical distancing, wash your hands regularly and thoroughly, and be watchful for symptoms of COVID-19. I have been taking call recently, and even in the past weekend, I have heard of transmission happening between cases when people are not wearing their masks, when they're not physically distancing. So I'm still hearing about that kind of transmission, and also we know that surfaces have been implicated in some of the transmission of the variants recently. So hand washing is super, super, super important. And also people who haven't been tested when they have symptoms. So I do really feel encouraged when I hear that people are getting tested even if they have mild symptoms, because that is stopping the chain of transmission. When symptoms emerge or you have been in a location where an infection has been reported, please get tested. By doing these things, you will reduce further infections, serious illness, hospitalizations, and deaths from the virus. Today, Public Health has confirmed 11 new cases of COVID-19 in New Brunswick. 5 of these cases are in New Brunswick, while 6 are New Brunswickers who are self-isolating outside of the province. And I know that has caused some confusion, and we are trying to rectify that and change that for the future so that it is very clear. In Zone 1, which is Moncton and southeast New Brunswick, there are 3 new cases, and one of these cases is outside of the province. In Zone 2, which is St. John, Kings, and Charlotte counties, there is 1 new case. In Zone 3, which is Fredericton and the St. John River Valley, there is 1 new case currently outside of the province. There is also 1 new case in Zone 4, which is the Edmundston-Grand Falls area. And I do want to give a shout out to Zone 4. Jeanette Pellerin has been leading a great amount of teamwork up there to look after the Pavillon Beaulieu outbreak, and it's been a challenge, and I just want to commend her and the prompt teams and the Red Cross for really working together to manage that situation. There is 1 new case in Zone 5, which is the Campbellton-Restigouche region, and in Zone 7, which is the Miramichi area, there is 1 new case currently outside of the province. There are 3 new cases in Zone 6, which is Bathurst and the Acadian Peninsula, and all of these cases are outside of New Brunswick. New Brunswickers who have contracted the virus somewhere else in Canada and are in self-isolation or hospitalized there are counted among our case numbers. And this is a standard practice for all the provinces and territories.
Today, Public Health has confirmed 11 new cases of COVID-19 in New Brunswick. 5 of these cases are in New Brunswick, while 6 are New Brunswickers who are self-isolating outside of the province. In Zone 1, which is Moncton and southeast New Brunswick, there are 3 new cases. In Zone 2, which is St. John, Kings, and Charlotte counties, there is 1 new case. In Zone 3, which is Fredericton and the St. John River Valley, there is also 1 new case. There is 1 new case in Zone 4, which is the Edmundston-Grand Falls area. There is 1 new case in Zone 5, which is the Campbellton-Restigouche region, and 1 new case in Zone 7, which is the Miramichi area. There are also 3 new cases in Zone 6, which is Bathurst and the Acadian Peninsula. As I noted, a number of these cases involve New Brunswickers who are not in New Brunswick at this time. New Brunswickers who have contracted the virus elsewhere in Canada and who are in self-isolation or hospitalized outside of the province are counted among our case numbers.
We have changed our reporting because these out-of-province cases now make up a larger share of our total case count than they have done in the past. And these cases have also impacted areas that have otherwise had very few recent cases. So I do recognize this is confusing. I do receive emails about this confusion, and people are trying to understand the impact of the virus within our province. So it is important that we address that, and so we are looking at how we can better reflect the real picture in New Brunswick on our dashboard. So that work is being done.
Over the past 2 weeks, 33 New Brunswickers have contracted COVID-19 outside of the province. There are now 11 New Brunswickers in hospital due to COVID-19, and this includes 3 people in an ICU ward. 4 of these cases are hospitalized elsewhere in Canada.
During this 2-week period, 27% of the 155 new COVID-19 infections we have reported involved workers traveling regularly outside the province. We have also confirmed a case recently that has been related to the ongoing outbreak in Nova Scotia. And we have to remember that this virus is all around us outside of our province, and it is very, very easy for it to continue to enter our province, even with the restrictions that we have in place. And again, being on call, I get the calls about the new cases and where they've come from and how they arrived and what transpired in terms of the risks of transmission. So it is an ongoing risk. The fact is, the highly contagious variants and the situation outside our boundaries, travel anywhere outside New Brunswick, is bringing that risk into the province. So this underlines the need for everyone traveling in and out of the province, no matter how far they are traveling to and from, to strictly follow self-isolation guidelines. And as I said before, I think most people are following all of those guidelines. And I think with the variants, we are seeing situations where people are doing everything right, and we're still seeing some situations where transmission is happening. So that's why we have to be more vigilant about everything that we've been doing with our layered approach. From the beginning of the pandemic, we've had a layered approach with our border measures, with physical distancing, with reducing different risks by how many people you can socialize with, making sure you wear your mask, staying 6 feet apart. Hand washing and disinfecting right now is very, very important with these variants. So right now there are 11 New Brunswickers in the hospital, including 3 in an ICU ward, and 4 of these cases are hospitalized elsewhere in Canada. New Brunswick now has 149 active cases of COVID-19, and no matter where they are, every New Brunswicker who has been infected with COVID-19 needs our care and concern. Please keep them in your thoughts and prayers as you go about your day. There are a lot of family members here in New Brunswick that are worried about their loved ones outside of the province as well as inside the province. I would like to offer my thanks to the administration and staff of the University of New Brunswick for their assistance in managing the outbreak at the McGee House residence. Self-isolation orders ended on Saturday for these residents who have been tested negative since the outbreak began. I also want you to, sorry, I'm going to read that again because it might not have been clear. The self-isolation orders ended on Saturday for those residents who have tested negative since the outbreak began. I also want to draw your attention to a change in how our vaccination rate is reported. We have publicly reported the percentage of eligible New Brunswickers who have received at least one vaccination. And until this week, this included only New Brunswickers over the age of 16. As we are now moving toward vaccinations for anyone over the age of 12, based on the most recent expert evidence, the pool of New Brunswickers who will eventually be eligible for vaccination has grown by about 30,000 people. So this will have an effect of temporarily lowering the percentage of vaccinated New Brunswickers. But as we expand eligibility this week, the percentage will quickly begin to grow again.
We are making progress in our journey through the COVID-19 pandemic. We still have some distance to travel, but the road ahead is starting to look clearer. More New Brunswickers are getting vaccinated. Every region of the province is again at the yellow alert level.
But we only have to look at our neighbors in Nova Scotia to see the dangers that continue to exist. COVID fatigue is real, but so is the virus, and it does not care how tired we are. This is the time when we must all remain steadfast in our actions to prevent further infections and new outbreaks. If we let our guard down, it will happen. And again, when I was on call on the weekend, I would get notification of a case, and in some cases, a decision was made to rapid test the close contacts, and within less than 24 hours of the the case being identified, the close contacts were already positive for COVID-19. It is a huge risk right now with the variants, and that, again, that is why I'm trying to emphasize to people that we cannot let our guard down right now. But there is hope on this spring day. We need everyone to stay focused and to help us limit the spread of COVID-19 and get vaccinated. And we will continue to make all of this happen by working together as we have since the beginning of the outbreak, of the pandemic, rather. Thank you very much.
Good afternoon, everyone. Bon après-midi, bienvenue. Je tiens.
I would like to thank the people of Zone 4, the Edmundston region, and more specifically, the people of Edmundston and the Omarowaska, St. Leonard, Grand Falls, Drummond, New Denmark, and Four Falls. You have followed public health advice and taken the measures needed to contain the spread of COVID-19 in your region. It wasn't easy, as Dr. Russell said, but your hard work and determination have paid off.
Cabinet and the All-Party Cabinet Committee on COVID-19 have accepted the recommendation of Public Health and will happily moving those areas from the orange back to the yellow alert level as of midnight tonight. As Dr. Russell said, the first times in a while that we've had the whole province back to yellow. That's great news. And we've done really well to get to this place. The whole province being back to yellow, it offers us more freedom to travel within our province, freedom to expand our bubble back up to 15 people from outside of our household, enabling us to see some family members and some friends and to socialize with them, including going out to restaurants. And as a province, we should be pretty proud of being in this position, but we must not forget how quickly things can change. We've seen what is happening in Nova Scotia, a province we are probably more closely tied to than any other. We've watched with concern the daily numbers of cases growing and growing, and the restrictions that the government of Nova Scotia is having to put in place to try and contain the spread of the coronavirus and its variants.
Most of us know people who are directly affected, since many New Brunswickers have family and friends living in Nova Scotia. And we know that what happened there could easily happen in New Brunswick if we're not careful. We must continue to do what is necessary to keep ourselves, our loved ones, and our communities healthy and safe, and to slow down the spread of the virus while we roll out the vaccination throughout the province.
This is the best part about being part of these briefings. As of this morning, 278,811 New Brunswickers have received at least the first dose of a COVID-19 vaccine, a vaccine that this time last year we wondered would ever even be developed. Dose 2 clinics have now been held at 75% of long-term care homes in the province. The remainder will take place by month's end. And as well, the Department of Social Development has confirmed that more than 63% of long-term care home staff have received their first dose of a COVID-19 vaccine, and almost 36% of those staff have received 2 doses and are now fully vaccinated. Beginning today, anyone 40 years of age and older is now eligible to schedule an appointment online at www.gnb.ca/book-a-vaccine, all one word, no punctuation, hyphen, stops, or anything else, book a vaccine, to receive their first dose of a COVID-19 vaccine through Vitalité or Horizon Health Networks, or by contacting a participating pharmacy. So if an individual is eligible, or a caregiver or a family member is acting on their behalf, if they can't book an appointment or at a clinic online, they can call as well at 1-833-437-1424. Reminder for everyone, walk-in appointments are not available. So please go online or make that call to 1-833-437-1424. If you have a vaccination appointment that you cannot attend because you've been directed to self-isolate, please reschedule your appointment. That'll allow someone else to fill up that space and help us get more people vaccinated as quickly as possible. So our rollout's going well, numbers are moving in the right direction, but as we've seen in Nova Scotia and elsewhere, the virus is not behind us yet, and it continues to have an impact here in New Brunswick. So over the weekend, we learned about cases at 2 schools and in 1 childcare facility in Zone 2. The cases were confirmed at Kennebecasis Valley High School, at the Dr. A.T. Leatherbarrow Primary School, and at the Go-Go after-school program located within Hampton Elementary School. As there was already no school scheduled today at KVHS, most students will return to school tomorrow unless otherwise advised by public health. So as usual, no news is good news. I want to thank everyone for their collaboration, particularly as public health advised students, staff, and their families at both Dr. A.T. Leatherbarrow and the Go-Go after-school program to self-isolate until 11:59 tonight while contact tracing is carried out. So as usual, the reason why we're doing so well in our fight against COVID-19 as a province is because New Brunswickers take it seriously. When asked to provide contact information, you do. When asked to follow the directives from public health from the government, you have. And despite the ups and downs of the last year and a bit, it's put us in a good position, but only because New Brunswickers have taken the rules seriously. So I'd like to take this moment to remind all families, even those with high school students engaged in blended learning, should you have any difficulties connecting to remote learning, we have got remote IT services available to assist you. So it's another number here. That number is 1-833-453-1140. And they can help you out with questions you have about Office 365, Teams, D2L, or Wi-Fi. And I could often use those services myself. All our planning and the experience we've gained this year continues to allow us to have a coordinated response across the entire education system and to respond to rapidly evolving situations. With the outstanding collaboration between teachers, school staff, districts, public health, and the department, we've managed to minimize impacts on learning while keeping our school environments healthy and safe.
We will continue to work with our partners to minimize the impacts on students' learning while protecting the health and safety of our students and staff. That being said, the situation can evolve rapidly every day, hour to hour. This is why we are asking families to remain vigilant and to be very attentive to any symptom that could appear. If you have any doubt, if you're not sure, you must go take a test. The end of the year is coming fast, and we need our communities to work together to keep our schools safe, healthy, and open. Today, we have published our guidelines on the diploma ceremonies. These guidelines will help the schools to plan their events to make sure that our remarkable graduates can get the congratulations they deserve for reaching this important milestone.
When talking about end-of-year ceremonies that can be held, of course they depend on the pandemic situation in every region of the province and the associated public health alert level. All ceremonies or activities will have to follow the mandatory order and the operational plan of the venue hosting the event. So for example, if it's at a school, they'll have to follow the school's operational plan. If an event's being held at a community center or at an arena, then participants would have to follow the operational plan already in place for that building. And if the entire province moves to a more restrictive alert level, then events will have to take place virtually. And as we've known with COVID-19, those changes can happen at the last minute. Otherwise, smaller in-person ceremonies are permitted in the yellow alert level. Options for drive-through or drive-in ceremonies will be available in the orange alert level, and for red or lockdown ceremonies will have to take place 100% online. So the full guidelines there are going to be available on the Department of Education and Early Childhood Development's COVID-19 website. If anyone has any trouble finding that, you can drop me a note to dominic.cardy@gmb.ca and I'll point you in the right direction. And it's again a moment to say that we know that the last few weeks of this school year feel a little bit like some sort of horrible race as we try and get to the end to make sure that our students are protected, but also that our schools stay open and safe. And as we try and fight against the vaccines, against the variants, as we try and get vaccines into people's arms. For the graduates who are going through not just the usual stress of grade 12 and dealing with the end of their time in public education and all the changes that that brings, COVID-19, of course, has added an enormous extra burden of stress. So I want to thank the graduating class of 2021, as I had to, sadly, last year, the graduating class of 2020, for their tolerance and patience and for having to endure things that most grad classes haven't had to deal with in a long, long time in terms of the disruption, the stress, and the fear. And for all the teachers and families who support those students, thank you to you as well.
Since organizing proms in schools will not be possible this year for obvious reasons, I'm convinced that schools and school districts will show creativity in their planning, as we've seen so many people do last year.
So I'd like to urge families planning their own celebrations to recognize the accomplishments of their grads. We talk about safe grad ceremonies around having alcohol and drug-free grad ceremonies. Let's try and make sure we have COVID-free grad ceremonies this year. Please make sure that any events, any activities that you're organizing meet the standards set out in the mandatory order. If you're renting a venue, work with the staff to ensure the activity meets all standards. Encourage your kids to be safe by modeling the sort of behavior that you'd hope they'd be showing as adults. If you're holding an event yourself, please see the mandatory order, learn the rules, and follow public health advice. And that includes physical distancing and mask use. And again, don't hesitate to get in touch with my department or myself directly. We're happy to point you in the right direction to answer your questions. So please continue to take every precaution you can to protect those around you, your friends, your families, your neighbors, and our students in the coming weeks. Follow the public health advice, and when you have your chance, take that first shot. Keep your distance, wash your hands, wear your mask. We're getting closer to the end here, but we need to keep working together to get there. And les précautions,
The precautions and health measures that we are taking are there to protect us, but others as well. So thank you very much.
Merci beaucoup, Monsieur le Ministre. Dr. Russell, thank you both. We'll now proceed with questions from members of the media. Each reporter will have one question and the quickest follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi très rapide. Voulez-vous assurer de désactiver le son de vos micros? Laura Brown, CTV.
We saw several people die last week at Pavillon, and I'm wondering, they all, from what I understand, had their first dose of the vaccine. And they had that dose back in, from what I understand, February. Does that concern you that we are now seeing at least a handful of deaths, even though they did receive the vaccine?
Hi, Laura. My understanding is they received their first dose in February and they received their second dose in April. In terms of that particular facility in general. And to protect confidentiality, I can't speak about specific cases, but in a general sense, we will still continue to see transmission of COVID-19 even after everybody has 2 doses. But hopefully the outcomes will be not severe in terms of not requiring hospitalization, not requiring ICU admission, and not passing away. Now, in this particular facility, as you know, there are different types of people in terms of, age, comorbidities, and also we have to understand that all long-term care facilities and nursing homes have advanced care directives for all of their patients. So some patients do not wish to be resuscitated, some patients are palliative, etc. So when you take all of that into account, again, these are some of the factors that can play into how outbreaks are going to go moving forward in the future. So the hope will always be that, again, people will have a large amount of protection from their first dose, but that immunity won't kick in until 2 to 3 weeks after that first dose. And ideally, the maximum protection that the vaccines will provide is 2 to 3 weeks after their second dose.
Thank you. Do you have a quick follow-up, Ms. Brown?
Yes, I'm wondering, we've been hearing that people who are intending to move to Nova Scotia are being stopped at the Nouveau-Brunswick, Quebec border and being told they cannot continue on. Can you, either of you, can you kind of talk to me a little bit about what provisions are there for those who are wanting to drive through Brunswick into Nova Scotia.
I haven't heard that situation, Laura. I can't imagine that they would be denied passing through New Brunswick to move to Nova Scotia.
Dominic here. Let me check that with folks at Public Safety and get back to you as soon as we're done the press conference. We understand that they can go directly. It's the usual restrictions around stopping and so on, but.
Jean-Philippe Hughes, Radio-Canada.
Oui, bonjour, j'ai une question.
Hello, my question is for Dr. Russell. We've learned that we would be receiving a lot of Pfizer doses in the weeks to come, and that we would be opening it up to new age groups. Are we still expecting the age groups to move from 10 years per week? Yes, that is our plan generally, but we could even go faster if we receive more doses. Do you have a follow-up question, Mr. Hughes? Yes, for Dr. Russell still. For Zone 4, the situation is improving. This morning on the radio, you were saying that you were concerned about Zone 1. I know that there's been some exposures, but I mean, we've seen exposures all over throughout the pandemic. Can you tell us why you're particularly concerned for Zone 1? So the cases that we're seeing in Zone 1 at the time have 2 chains of transmission. For both of these, we're seeing public exposures that are associated to the cases. What we're seeing also is that there's a transmission of the variants. It is concerning right now because we aren't able to find the index case, so we can't see where this started from outside of the province. What this means is that for the time being, we will continue to try to find the place where these cases were exposed to COVID-19 for both chains of transmission. And until we have that, it is concerning because it means that there is a potential for community transmission. With the number of cases in Nova Scotia right now and in Halifax, we're seeing over 100 daily cases over there. Here in New Brunswick, we have maybe 10 cases a day. The difference between 10 cases and 160 cases a day is a huge one. What this means is that the risks of cases, is increased. We've seen a case that came from a transmission from the Nova Scotia outbreaks and that came into New Brunswick. So I have concerns. I fear that this would increase. The risks are very high right now, not just in Nova Scotia, but in other places, and that is due a lot to the presence of variants. So we will continue to monitor the situation in Zone 1. Also, in terms of vaccination, we will be receiving 41,000 Pfizer doses. So 40,000 Pfizer doses, 21,000 doses of Moderna, and obviously this is an approximation. I can't say it. Approximate. And we should be getting them around the 17th of May.
Merci, Dr. Justin Dupuis, l'Acadie Nouvelle.
Hello, Madam Russell. Earlier you mentioned that younger people would be admissible for vaccination. I think you said 12-year-old, and that would represent about 30,000 New Brunswickers. I'm wondering if we're still on track to meet our target of June for all New Brunswickers who want to be vaccinated to receive their first dose. Yes, for the first dose, absolutely. Do you have a follow-up question, Mr. Dupuis? No, thank you. Thank you. Natalie Sturgeon, Brunswick News.
Hi, my question is for Dr. Russell. So today we heard from a parent who was given 3 different dates when her son may have been exposed at Kennebec Youth High, and also 2 different dates to self-isolate. I'm just wondering how it's possible that she could get that sort of conflicting information and what they should do about it in terms of following the advice.
I can start answering that, and then if Minister Carty wants to jump in. Obviously, there are different situations that are evolving all at the same time. So when investigations happen, sometimes there's overlap in terms of cases in different settings. So I can only say that whatever information has been given, I would follow the most cautious and conservative of that advice at this moment. And usually the public health nurses are very good about following up and making sure that people have the correct information. But again, there can be overlapping investigations and overlapping settings where different cases are being investigated. So again, each situation is unique. And again, if that person happened to be in different settings where they were identified as a close contact, again, that could point to the differences in the information they're given. But again, whatever the most cautious advice is, that would be the advice that I would go with until a public health nurse can clarify and follow up.
Yeah, just to add to that, first, in terms of taking the most conservative advice, obviously, absolutely, that's the best advice. Is so take the most time to self-isolate, the most time away from people, and we have had a few cases over the course of the last year with over 40 schools affected by COVID-19, where there have been different issues with, in some cases, people getting 2 pieces of information. This is going to happen. This is a massive undertaking to try and protect this province against COVID-19 with a team that's shown themselves to be up to a world-beating level in terms of their ability to do it. And what we have to do is make sure we give our teams time to complete the contact tracing, make sure that we're protecting everyone in the school community. So for anyone who ever receives, regardless of the context, whether it's, I think, in a school or elsewhere, otherwise, always follow the most conservative advice. And if you have questions, check before you go outside.
Sturgeon, do you have a follow-up?
So, thank you.
Vicki Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, can you tell us more about the federal government's initiative to make rapid tests more widely available to businesses by distributing them to chambers of commerce across Canada? When and how will this be coming to New Brunswick?
So we do have plans already in place. Actually, there are several businesses who have, now when you say rapid test, I just have to qualify that definition. The type of tests that I'm aware of right now that are in the hands of certain businesses would be the screening kind, although I am aware that there could be a business that is interested in doing the PCR tests, which are the diagnostic tests. So as you know, as I've said before, there are the diagnostic tests, and you can have a rapid diagnostic test, but that would be a PCR test. The screening tests are not diagnostic. And they do have lower sensitivity and lower specificity, which means that you will miss people, meaning you can have false negatives. And the screening tests are not actually designed to be used on asymptomatic people. So again, there are different types of tests. So when you say a rapid test, the best kind of a rapid test would be a diagnostic PCR test. And if there are any companies that have access to those, they would be few and far between. But certainly the other types of screening tests, my understanding is there are several companies in the province who are using those.
Ms. Hogarth, do you have a follow-up?
I guess this would be, what would be your advice to businesses looking to take part in this opportunity to have these tests?
In terms of, I believe that our connections with businesses are through Opportunities New Brunswick. I think that's where all the information and guidance is being funneled through.
Thank you.
Oh, and I actually wanted to give a shout out to the Georges Dumont lab. They have now gotten past the number of 300,000 tests that they have processed in their lab, which is a huge milestone. And we're very proud of the work that they do there. And also the additional work that they've taken on in the recent weeks is being able to sequence very, very quickly the positive test results to determine which variants are involved in the different cases. And it's proved very, very important for our case investigations, because we can tell just because somebody has a case, cases are in the same zone, if they don't match in terms of the strains, then we know we have to go looking elsewhere for the source of those of some of those cases. So it's been extraordinarily helpful, the work that they've been doing.
Thank you, Doctor. Thank you, Ms. Hogarth. Adam Harris, Brunswick News.
Thanks, Bruce. Dr. Russell, in your opening, you raised some concerns about the U.S. CDC guidance for people who are vaccinated. Could you just elaborate on that? Is it too liberal, and are there concerns that people may follow that instead of Canadian guidelines?
Well, I do understand that people go on the internet and find different sources of information, and I'm just cautioning people who do read the information that's on the CDC website that it is designed for U.S. citizens, and we are in Canada. We have a different situation. We have different epidemiology, and certainly here in New Brunswick, we've had a totally different approach from the rest of Canada. Well, the Atlantic provinces have, and so I would caution anyone who is reading that information to take it with a grain of salt and really focus on what the advice is here in New Brunswick around following all public health guidance until all of our population has 2 doses of vaccine on board, and really and truly, that is when the maximum protection will be afforded to New Brunswickers, and that won't happen until close to September.
Mr. Hears, do you have a follow-up?
Yes, please, Bruce. On the addition of 40 plus, I wanted to know if public health is satisfied with the uptake of vaccines so far for the 50 and 60-year-old cohorts. It seems things are obviously moving a lot quicker now, and that's largely because of an influx of doses being provided to the province. But is it anything to do with take-up as well in terms of those age groups?
My understanding is the uptake is great, and as soon as we get vaccines, they are going into arms, and that is very, very good news. And again, it just gets us closer to our goal. Again, if things go quicker with respect to the arrival of doses, then we will just speed up our ability to be able to give those vaccines as soon as possible. So we are looking to our RHAs and our pharmacies right now to promote those clinics, but we also have in our planning with the vaccine task force, looking at larger venues and the ability to vaccinate people in larger volumes. Again, as the volumes of doses increase, we're going to match that in terms of our capability to be able to get those doses in arms as quickly as possible, so that if we can get 2 doses into everybody between now and the beginning of September, then we will absolutely be able to do that, and if we can do it sooner, then we will.
Mr. Hears, thank you. Dr. Madeline, allbrunswicknews.com.
Thank you. Dr. Russell, Saskatchewan last week laid out a 3-step plan for reopening, with the easing of restrictions tied directly to the percentage of the population that's vaccinated. Is New Brunswick working on something similar? And if so, when do you expect it will be released?
So any types of information like that, I did see that information from Saskatchewan. Those types of discussions happen at many different levels, including at the Special Advisory Committee level, which involves all of the Chief Medical Officers of Health in the country. But we also discuss it with our own internal team of public health experts, as well as providing those types of recommendations to Cabinet. So if and when we're ready to move in that direction with respect to providing that kind of advice and information, we will do so. But keep in mind that, again, that type of relaxing of public health restrictions is not only based on, in terms of the advice from Public Health Agency of Canada, it should be based on not only the vaccination rates and uptake and percentage of people with 2 doses on board, but it should also be a reflection of the epidemiology in your particular jurisdiction as well.
Thank you, Dr. Madeline. Do you have a follow-up today?
Yes, thanks. There have been cases, especially in Ontario, of people using the land border between U.S. and Canada to avoid the hotel quarantine that's mandatory for air travel. Is New Brunswick seeing instances of this, and do you think the hotel quarantine should be mandatory when crossing the land border too?
I feel like that has been discussed and that particular gap was addressed recently. I'm not sure if the operationalization of that has been completed, but definitely it did get flagged and we were aware of that situation, and my understanding is that there had been conversations with Department of Public Safety to address that.
Thank you, Madeline. Thank you, Dr. Savannah Odd, Telegraph Journal.
Well, I just want to add one thing about that. Sorry. With respect to the risks, obviously any traveler coming across any border into New Brunswick, whether it's international or domestic, carries risks. All the jurisdictions outside of Atlantic Canada, outside of New Brunswick, have higher rates of transmission right now of COVID-19, have higher numbers of cases, and the variants of concern are continuing to grow in terms of the numbers that we're dealing with. We have the UK variant, we have the Brazil variant, we have the India variant, we have the South African variant. So we are very, very concerned about these variants of concern and variants of interest because they are 30 to 70% more transmissible, and they are causing more severe symptoms and causing hospitalizations in younger and younger people.
Thank you. Savannah, Telegraph Journal.
Hi there, my question is for Dr. Russell. Last month, you voluntarily shared that 3 hospitalized cases had 1 dose of the vaccine, and you gave the timeline since the dose for each of those cases. So I'm wondering, just on Laura's question, why now, in the case of Pavillon Beaulieu, will you not disclose that exact same information about the 5 people who died?
That is a great question. Again, whenever we're trying to be respectful of confidentiality, that is when we try to not overshare. But certainly the point around anybody who is hospitalized or has an ICU admission or unfortunately passes away, we're trying to make sure that the public has information to protect themselves. That is the barometer of what we use in terms of sharing information. So if I say to the public, you need to get your 2 doses of your vaccine to be maximally protected, not only for yourself in terms of getting COVID-19, because the vaccines aren't 100% effective, they're very, very effective against hospitalization, ICU admission, and death, but it only applies if, again, the right amount of time has taken place, et cetera. And what we do know, there is data right now from other jurisdictions that show that even with 2 doses on board, we will still have a small number of people who will contract COVID-19. We'll still have a very small number of people who have severe outcomes. And we can usually measure that in terms of a percentage of the total case numbers, and you can see dramatically how those numbers drop in places like Israel and the UK, who have the majority of their population vaccinated with 2 doses.
Ms. Odd, do you have a follow-up?
I do, thanks, Bruce. Minister Carty said, I believe it was 63% of long-term care staff reported as vaccinated. Can you specify whether all homes responded to social development survey for that number, or how many staff members are accounted for with that survey?
I think Minister Carty neither one of us actually has the data on that, but what I can say is that obviously healthcare workers in any setting ideally should be vaccinated with 2 doses as soon as that's possible, to be vaccinated with both doses. But separate from that, again, until the entire population is vaccinated with 2 doses, there will be risks. And so at this moment in time, social development has worked very hard at making sure they have good screening procedures. They've been working with public health and Ambulance Nouveau-Brunswick and EMP in outbreak settings, et cetera, to make sure that all the things that can be done are being done, and including making sure that people are being screened and making sure that they get tested if they have symptoms.
Thank you, Ms. Odd. We're going to Bobby Jean McKinnon, CBC.
Yep.
Oh, hold on.
Hello?
Hold on, Bobby Jean. The minister would like to say something.
So we can talk with social development, do our best to get you the most broken down numbers there in terms of any additional data we can have. But as we get into vaccinating and opening up vaccinations for folks outside of those specific professional groups, we're seeing a huge uptake in the sort of the age groups where people are often working in a lot of these homes. We've got a 6,000 person wait list from this morning as the new age range was announced. So we're seeing a really enthusiastic uptake from people in the Gen X, now getting into the millennials, really embracing the opportunity to get their first shot. So that's, I think, a good sign, and we see those numbers moving up all the time as those homes as well make sure that their staff can get the time they need to be able to get vaccinated.
Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, how many residents and how many staff at Pavillon Beaulieu have now tested positive?
The last information that I had received, 38 residents and 15 staff.
Next question, Ms. McKinnon.
Yes, for Dr. Russell again. How many COVID-19 positive cases do we have here in New Brunswick from other provinces?
Oh, that's a great question, because I know we were talking very explicitly about making sure to identify the cases that are of New Brunswickers who are isolating in other provinces right now. I don't actually have that information, but I'll try to get it for you, Bobby Jean. And just to clarify for communications folks, when we're going to try to find that information for you, is that are there people here who are self-isolating, who are cases that are counted in other provinces? Because we've done the reverse. We've let people know who's isolating outside of the province who is a New Brunswicker. But which non-New Brunswickers are isolating in New Brunswick right now? I actually don't know if we can get that, but I'm going to look to make sure that if we can get it, we will get it. I'm pretty sure we can.
Isabel
I'm
Legier.
hoping we can.
Isabel Legier, CBC.
Hi, my question's for Dr. Russell. How many students, staff, and their families at KV High School and Leatherboro Primary School have been told to self-isolate for 14 days? And do we know yet if these cases are travel-related and if they're linked?
I have not been covering that particular region, and I do know that over the weekend there was quite a bit of activity in terms of investigation and contact tracing and letters going out. So I don't have the exact number, although, again, I think people are looking for it right at the moment. Getting that for you. So I think it's upwards of around 230 or 250 among those two schools, one school. So KV, 230.
Dr. Leatherbauer.
Great.
Oh, Dr. Leatherbauer. Does that help?
Isabel, can we have your follow-up, please?
Yeah. Can you also provide us with an update on McGee House? How many students, staff, and their families at McGee House continue to self-isolate? And has the elevator been confirmed as the source of transmission?
Well, I'll answer the elevator question first. So surfaces definitely were the cause based on all the investigations around the ventilation system, et cetera, and questioning the cases, et cetera. So our final conclusion, based on the fact that we did not find anything else, that is our best hypothesis and conclusion at this point in time. With respect to McGee House, we are looking to get you another update. I know we released the families and residents who were not close contacts at this time, but I don't have the exact number of cases and close contacts who are still self-isolating, but I can get that for you.
Okay, great. Thank you.
Michelle Corvo, Radio Canada.
Hi, my question is for Minister Dominic Cardy. Mr. Minister, given the psychologist's fear, will you be going ahead with Bill 35? Can you repeat, please? I heard the start and the end, but not the middle. You said something about psychologists? Given the College of Psychologists' concerns, do you think you'll be going ahead with the non-amended Bill 35? I mean, I don't know if there'll be some amendments during the legislative debate process, but generally, we want to go ahead with the plan. We want to train 25 people who already have a master's. We want to give them 1,000 additional training hours to make sure that we can address the great lack of access to psychoeducational assessment in our schools. So we fully intend to go ahead, and we would be happy to continue our conversation with the college and various other stakeholders. But this is not a bill on psychologists. This is a bill for the children of our province. For many years now, they've had to wait for a service that should have been offered as soon as possible. The college is saying that because the teachers won't be experts, there could be children falling through the cracks. That's their point of view, and that is not based on reality. Today, we have children who don't have any access to any service or any assessment program. And that's something that we will be addressing with our program. It's the same kind of program that we want to implement in New Brunswick here next year that already exists elsewhere in Canada. It is well managed and it offers services to students, which is really the reason why we're here and managing a public education system, the students. It is not at all true that children would fall through the cracks. Today they have access to nothing. They don't have access to any program. So I think the college needs to maybe get reacquainted with our school system's reality. Thank you.
See, Ms. Odd, Dr. Russell has something for you.
Are you still on there, Savannah?
No.
So social development, they actually received the data from 69% of the homes, so 390 out of 566.
Merci beaucoup tout le monde. Voilà la fin de notre mise à jour. Merci beaucoup. Thank you all. That concludes today's update.